We end programming to bring you this News 18 special report. News from where you live.
Good evening, I'm Jeff Smith. Thanks for joining us. It's an unprecedented time in our nation's history with schools, restaurants, libraries, and churches closing to contain the spread of the coronavirus. Tonight, there's still a lot to understand. How successful will those efforts be? How will we know when it's time to get back to normal? And what will the coming weeks and months look like under these extreme circumstances? We're joined this evening. We have assembled a series of people to help us address those questions tonight, including community leaders and health experts. And we're starting with a panel to help us better understand the medical and scientific aspects of the coronavirus. I'm joined by Richard Kuhn of Purdue's Department of Biological Sciences. Dr. Kuhn was on the team that mapped the Zika virus. Dr. Daniel Wickert on my far left is Vice President of Medical Affairs for Franciscan Health in Lafayette. And Dr. James Bean is Chief Medical Officer and Vice President of Quality and Safety for IU Health Arnett in Lafayette. Doctors, thank you so much for joining us. Dr. Kuhn, I wanted to start with you. We hear a lot of comparison between the coronavirus and the flu. What, if any, comparisons are there?
So the most important comparison is the way they're transmitted. These are respiratory viruses, and so aerosols, coughing, contact with surfaces that have been exposed to those kinds of things, that's where they're very similar. They are completely different types of viruses. And so if you have protection or if you've been vaccinated against influenza, flu, it's not going to help you at all against this coronavirus.
Let me run some numbers by you. I just got these from Johns Hopkins information tracker on their website. World population 7.8 billion, roughly. Total confirmed cases of coronavirus 215,000. Total deaths 8,732. Yet we're essentially shutting down the world economy over this pandemic. Why, when we don't do that with the flu, which kills, what, 15 to 50 or 60,000 Americans every year?
Yeah, so normally every year we have what we call seasonal flu. This is something that rolls around that we don't have great protection against, and that's why we ask people to get vaccinated. But it's not what we would call a pandemic flu. And we've been worried, and we've been talking about this pandemic flu that might occur and will occur sometime in the future. The 1918 flu was a pandemic flu in which a lot of people died, and a lot of young people died, and that's because of the biology of the virus.
Help us understand the word pandemic and why that makes the coronavirus a pandemic versus what happens with what we consider the seasonal or the normal flu.
Yeah, the pandemic is usually something that we haven't seen and that we don't have a lot of immunity against. And what's going to happen is if you don't have immunity, it's going to spread very rapidly through the population. And that's exactly what we're seeing with COVID-19.
What do you see of the numbers right now?
The numbers are only going to be going up, unfortunately. What we hope with this social distancing and quarantine is that we will hopefully lower the rate of infection.
And that's where these gentlemen come in. They're the frontline medical experts, and I'm going to throw this out to Dr. Wickert and Dr. Bean, and you guys decide who answers this. What have your ERs looked like over the past 14 days?
Well, initially not very different until probably the past week, when as more media attention and more attention to the condition has become known, more and more people are coming in and believing they have the virus, potentially have the virus, and want to be cared for, treated, and evaluated for, do I have this problem? And I think recently, probably in the last few days, even today particularly, we've noticed an uptick in number of people who have presented for evaluation.
Dr. Bean?
Yeah, we've had a very similar experience. I'd even say it was a little bit slower than typical over the last few days. And my assumption is that's related to people taking the advice that we're providing to heart and staying home and not presenting with complaints that they otherwise may have.
When should somebody come to the emergency room, and when should they call in?
That's the best question. So I think if, what we're advising people to do is use the emergency department judiciously. If you're sick, feeling quite sick, difficulty breathing, and more so than what we would typically do, more sick than if you would just go to the physician's office. The advice that I'd give is call your physician's office, or IU Health also has an app that's available to all of us in the state to have a virtual conversation with a clinician to gain advice on which direction they should go. But certainly people who are seriously ill or feeling quite ill, I think emergency care is the appropriate choice to make.
Now, I've heard anecdotally that a lot of people are coming to the emergency room asking to be tested. Is that happening?
Yes, there's some of that happening, and certainly
Is it warranted? Do you want that to happen?
no. I think if people really, what we know about the illness is that the vast majority are going to have a relatively mild illness if they have symptoms at all. And so the advice that we give for other viral infections, stay home, treat the symptoms, hydrate, physical distance from others. I like the term physical distance rather than social distance, because I think we need to be socially interactive, but at a distance, physical distance. So people who are handling the illness reasonably well can home treat. Going to the emergency room for the purpose of seeking out a test, or to even if you're feeling reasonably well, to get reassured is not what we're advising right now. That's going to use up some precious resources that we're very much trying to conserve.
Okay, now we've talked about resources, and I've heard Governor Cuomo talk about the wave crashing onto the medical establishment in New York. How many beds are there, how many hospital beds are available between your two institutions, and what's their average occupancy rate under normal circumstances?
So again, defining beds is always one of the challenging parts. About we're not going to include our NICU beds, our PEDS beds, our OB beds. We probably would have about 167 in that range of beds that would be available for adults.
At Franciscan?
At Franciscan. And on a normal day, our occupancy can be in the range of 85 to 90%. So even without this virus, both hospitals are busy and full most of the time. Oftentimes with people waiting in the emergency room in a bed hold to wait for a bed that would be available on a particular unit.
So our numbers are a little bit less in terms of adult beds in the 150s range, but similar occupancy rates. And one of the habits that we have gotten into is each morning clinical leaders from both hospitals communicate on what's happening at your facility, what's happening at our facility, so we're coordinating availability and responsiveness to community needs.
Dr. Kuhn, when you hear those numbers and you're familiar with the curve that these pandemics can take and have in this case, does that scare you about availability of resources in terms of potentially sick people?
Well, there's no doubt, I think, if the numbers continue to rise, that it's going to challenge our hospital systems. However, I think our clinicians and the staffs are trained in terms of understanding who should be triaged and who needs, immediate attention. I think this is one of the challenges, I think, in terms of understanding this, because you have a group of people who may not even get very sick at all, and then you have people who might be in a hospital, in an ICU for weeks before something happens. And so there's this huge spread, and it's a question of we need to make sure we can identify, you should stay home, you should stay isolated, no, you should come to the hospital, we need to put you in the ICU.
Now, I mentioned earlier that you were on the team that helped map the Zika virus. Is anything similar happening locally on Purdue's campus that you're involved in or may know about?
Well, yeah, I mean, there are quite a number of faculty and staff, students that are working now on COVID-19.
What are they trying to do, map it or?
I think we're trying to do all kinds of different things that will support the immediate crisis now. The immediate crisis, and I think this is one of our biggest challenges, is diagnostics. If we're using the diagnostics when we already have pretty severe symptoms, that's just a confirmatory case, right? We really want to be able to diagnose this within the first few days, maybe even before a patient becomes febrile. That would be ideal. So we have faculty that are working on new types of detection specifically for coronavirus. We have faculty that have some compounds that were developed against SARS that already show promise in the test tube against this new virus. So we have people doing a variety of different things. And we have also engineers who are looking at how can we disinfect surfaces in a more rapid way.
Okay, Dr. Kuhn talked quite a bit about testing, and we opened this up to questions from viewers, and that was maybe the most common question was, is testing available locally? How many test kits have you received? How does that process work?
Yeah, so I'm not surprised that's the question that we heard most commonly, because that's the one that is getting lots of media attention. So the answer is tests are still very limited. They're through the State Department of Health, and the individuals in the community that are being tested are the individuals that are the most severe, as Dr. Kuhn said, which is unfortunately late. It's a confirmatory test, but they're individuals who don't have another diagnosis, but are it's quite ill, hospitalized, and for them we're able to get testing.
So if you've got a patient locally in Lafayette at either one of your facilities, and you've ruled out flu and other causes, have you tested anybody in Lafayette for coronavirus?
Absolutely.
Yeah.
You have?
Oh, yeah.
Absolutely.
Yeah.
And how many have we done, do you know?
We've done, we checked today, and as I left the hospital, we have 14 people in the hospital who are waiting for results. Part of the challenge is the tests are taking quite a while to turn around. So our turnaround time for outside labs besides the state is now up to 6 to 7 days. We've had tests we sent in on the 11th and we still don't have results. So we have 14 patients in. We've tested for all 3 of our facilities about 42 in the 40s patients so far that we've tested.
Would
No
it be
one's come
fair
back
to-
positive.
No one has come back positive?
Not yet.
Yeah, I was going to estimate a few dozen tests for patients in our facilities
With the same results?
with the same results, yes.
Okay.
And the
Yeah.
same delay, for results.
And what's the cause for the delay?
That's a good question. I'm not able to answer that. It relates to the lab capacity and the demand that's being placed on limited resources.
Okay. Another question that we've had a couple of today was elective procedures. In one specific case, a woman's mammogram had to be rescheduled, and that is causing some anxiety for her. What's that look like, and why delay a mammogram? And other procedures. I can talk to you about another childhood allergy case that we received.
So I guess I'd respond by saying this is one of the most difficult decisions that we have had to make in attempting to reduce the contagion and reduce the contact of individuals. In addition, in an attempt to conserve the limited personal protective equipment resources, so the masks, the gowns, the face shields that are in limited supply nationally, we are doing everything we can to conserve those and to prevent contagion within our facilities. And the difficult decision to start to postpone, reschedule elective procedures, things that don't have to be done right now, but that in the doctor's opinion and in collaboration with colleagues have decided, yes, this is somebody that we'd rather not, but we can postpone their care. That's the decision we've had to make.
Very challenging decisions, very difficult decisions. What it does do for us, though, many times, is those elective procedures, if they would need to come into the hospital, and now we're not doing the elective procedure, we will free up additional beds. Yeah. And that bed capacity may be an issue in a short period of time, where we need those beds for people who are struggling with the virus.
Dr. Wickert, I'll just throw this out there. It's an email that we got today. I'd like to know why they're shutting down all doctor appointments that are non-emergency. They're stopping my daughter's course of allergy treatments for at least the next 6 weeks. She will have to go backwards and possibly have to start all over again. How does that relate to what's happening with the coronavirus?
These are the difficult decisions that everyone's making in the office. What are the non-emergency procedures so that we don't have individuals that come to the office in contact with other people, contact with our staff, contact with the front office, contact with all kinds of people that are involved in that. Very challenging, difficult decisions. We're trying to make wise decisions in this process, and not everyone's going to be happy about those decisions as we try to eliminate and try to say, we want to reduce the chance of people getting the infection at this point. Again, it's the element of overwhelming the system, and we want to really minimize that if possible.
What other preparations have the hospitals taken to prepare for potential cases?
So I will say we have built on a daily morning huddle, if you will, of clinical leaders and facility leaders that we've had in place for 10 years or so, where we meet and talk about what do we anticipate might happen today and what can we learn from what happened yesterday. So that process has been in place. We've expanded upon it. We are partnering with our statewide IU health system and doing a formal incident command preparation process. So leaders from all disciplines around the state are gathering and working on preparation for this, anticipating what might be, identifying capacity, making difficult decisions, as Dr. Wickert and I have just discussed. Another specific thing we've done locally is we've worked hard to quickly ramp up our emergency department capacity, anticipating that we may start to see more patients with respiratory symptoms presenting to the emergency department.
What's that look like to ramp up ER capacity?
So we have actually taken our ambulance bay and turned it into a temporary assessment place for patients who have respiratory symptoms but don't require an emergency department bed. They're not that sick, but they're sick enough to be seen in the emergency department. And we've added that additional capacity.
Dr. Wickert?
Similar things. We have designated specific areas within the emergency department where these individuals, these potential concerns would go to, separate from other individuals. And then we've actually now opened up one of our other areas, and that's particularly where those individuals will go. We're looking forward to, well, what's the next step if we have to go beyond that, and looking at tents outside the parking lot, looking at trailers, looking at extra buildings. How can we do this, and trying to plan for the future, plan for the worst case if it were to happen.
I want to just kind of a quick question for you, because I've got another follow-up for Dr. Kuhn. What do you want to tell patients tonight, right now? Or not patients, but the public.
The community?
Yeah.
I want to tell my message to the community would be, take this seriously. Really heed the advice that we are all getting to physically distance from each other. This is it's a respiratory virus that many will get and the vast majority will do very well with, but the most vulnerable people in our community are protected by the actions of the others. And so that's why we're not going to bars and restaurants. That's why we're not going to our places of worship. And that's why we're saying stay distant.
Dr. Wickert?
Mine, very similar. Don't panic, but take it seriously.
Okay, Dr. Kuhn, real quickly, and it's kind of a follow-up of what these gentlemen just said. Do you think too much is being made of this?
No. I think, if you look back at history, the only real pandemic that we can look back on occurred in 1918. Millions of people died. Now, you might say we're 100 years better, but not exactly. And so if we take the precautions, what the experts are telling us, if our hospitals are preparing, as we just heard, we have to continue to do that. And it's better to be safe than it is to be sorry, because it could be huge numbers. We hope not, but we need to be prepared for that.
Hope's not much of a plan, is it?
No, but we are planning.
Okay, very good. Doctors, thank you so much. Still ahead, we've got the mayors of Lafayette and West Lafayette, as well as Tippecanoe County's public health officer. You're watching Coronavirus Conversation. We'll be right back.
Testing, testing, mic 4, testing, mic 4. Very good.
And you're taller, that's why I saved that for you.
But you didn't want to sit short. Have you been to Florida?
I have, last week, yeah.
You know, there's another elected official that has an orange shoe to himself.
4, sound okay, Steve?
You can't say that.
Test it. Yes, I'll make him 4. Okay.
I'm gonna have you just pull.
What's that? You look so young. Oh.
We interrupt programming to bring you this News 18 special report. News from where you live.
And welcome back. We're joined now by Lafayette Mayor Tony Rosworski, West Lafayette Mayor John Dennis, and Tippecanoe County's Public Health Officer, Dr. Jeremy Adler. Gentlemen, thanks so much for coming in. Dr. Adler, I want to start with you because of the breaking news that you released this afternoon. A Tippecanoe County resident has tested positive for coronavirus, but is currently in Florida. What can you tell us about that?
That's correct. So today's announcement was about a Tippecanoe County resident who did test positive for coronavirus. But what makes this case different is that this individual became ill while in Florida and is currently hospitalized there and is being treated there. So this is not a case where we have a person here in our county with a confirmed coronavirus situation that became ill here in our county.
Well, you don't know that, though. Well, they didn't. I guess they didn't become symptomatic in this county, correct?
Correct.
So that person, as I understand it, has been in Florida for 4 days.
Has been in Florida longer than 4 days, was in Florida for 4 days before becoming sick, and then has been in the hospital since then and is currently still hospitalized.
So do you have a date for the last time that person was in Tippecanoe County?
March 10th is what we're hearing from the public health folks in Florida.
So about 8 days ago. Mm-hmm. And given what you know about the incubation period for coronavirus, what does that tell you?
Well, you know, that's a good question, and that's one of the things that our health department staff is going to be investigating as part of their investigation, is trying to determine when this individual may have become infected with the virus and what that means in terms of close contacts to this individual. And so our health department will be doing that sort of investigation and trying to delineate those factors.
So that's some contact investigation. What is that called? It's tracing?
Contact tracing, correct.
Contact
correct.
tracing. So I'm assuming that individuals, coworkers, friends, family members of that person can expect phone calls or knocks on the door to find out.
Sure, sure. So this contact investigation is something that we at the health department do all the time for many infectious communicable diseases. And so we have established protocols. We have staff that's very good at this, and they will begin that investigation. In fact, they already started it this afternoon before I left the health department. They were working on it. And they will identify individuals who perhaps had close contact with this individual. The important thing for, I think, the public to know is that our staff will contact those individuals who are deemed to be close contacts. So if you don't get a phone call from the health department, then you are not at risk of being a close contact with this particular individual.
Okay. How do you get their phone numbers? I guess you get them from the person, correct?
Correct, correct, yes. Yeah, the first step in the investigation is talking with the individual who has the infection and, of course, their family members.
Okay. Yeah. Mayors, I'm going to turn over to you. What and when did, on the city level, discussions begin about coronavirus and what you as mayors ought to be doing?
Well, for us, we started about 4 weeks ago in West Lafayette. We all started about the same time. As you know, in this community, we work together very well, whether it's an issue like this or economic development. So those discussions started about 4 weeks ago, looking about what the cities could do and how we would look at the situation. And for us, we have to look at it really from 3 points of view. One is health and safety, obviously. That's first and foremost. How do we, as a whole community, how do we ensure the health and safety of all of our citizens? Then we have to look at it from a local government perspective. How do we ensure for our employees that we have plans in place that allow us to continue to provide services for our community? We can't shut down the police department, the fire departments. People need water, and we provide water. So how do we ensure that we have plans in place that allow us to continue to provide those basic services, even in what could be some very challenging times? And then economically, we all know that this is going to have an economic impact on the community, and how do we continue to do the things that we can do to help us recover as quickly as possible. When this was over, we know that we have businesses that are hurting. We know we have people in the community that might live paycheck to paycheck that are going to need all the support they can get from us, and make sure that we're doing those things to help them recover as quickly as possible. How do we address things with our children that are concerned, and child care, and all of those things that we need to keep the community operating at some level, all the same time making sure we're doing the right thing from a public safety and from a public health standpoint to ensure we have as few people get sick as possible and we don't overwhelm our medical facilities.
Mayor Dennis?
Pretty much the same. I mean,
You're in a different situation, though, I
a
would
lot
think,
different.
because of the presence of Purdue University. Not to say that we don't have an international population in the city of Lafayette as well.
It's an international community now. But one thing we've realized is that social contact is essential for humanity. And we have been basically trying to control that through information. And that has sort of a double-edged sword. Obviously, they're going to find out what they need to know, but then how they react to that is sometimes a challenge. And we've learned just recently that when you're dealing with our population dynamic, you've got a large group of people from the ages of about 0 to 26, and then you've got a little bit of a gap, and then picks up again around 50 and goes up to infinity. And that's definitely the at-risk group. And there is so much information going on right now. There's so much stuff being put out about what can happen, what the symptology is, how to prepare, what you can do to prevent. And some of the information isn't necessarily very factual. And we have to deal with that. A lot of people come to local government, they come to our city halls and ask questions about how they should be conducting themselves. Then they also ask things about how they can continue to socialize. And that's when it gets to be a real challenge. We're social by nature. And when we tell people that something that they depend upon, whether it be a meeting space, whether it be playing bridge, whether it be an athletic event that they want to participate in, when we tell them that we can't sponsor that or we can't sanction that anymore, it can be a real dynamic for their quality of life. So we're sort of in that wind right now to where we're trying to make sure that people understand what the potential hazards are. We're trying to make them aware of what we as local government can do, and then we have to go to that next level about protecting ourselves.
I'm going to open this up to all three of you and maybe do kind of a round robin about it. We opened this conversation up to viewers to ask questions, and we've got a lot of questions about large manufacturers that are still open, and specifically the YMCA. Now, at what point does city government say that's an appropriate activity or that's not an appropriate activity, and what authority is there to close that down?
Well, I think one thing I'd like to say, I think it is important for everyone to know that the health department, the cities, the schools, we all are working collaboratively and working to share information to help make those decisions, whether it's what we're doing with child care, whether it's events that we've canceled at Columbian Park already, the zoo, different things that we're not going to do, user agreements like John was talking about that we've pushed back into April, all city travel outside the state has been canceled. All of those decisions are being made not in a vacuum, and I think that's very important for people to know that we are working together. We're talking, John and I talk sometimes several times a day, to make sure that those situations are not made in a vacuum and that they're made with scientific and medical data. That's very important. And so, at the end of the day, those types of decisions primarily would come out of the health department or from the governor's office about closing something like that based on a medical scientific reason. But, you know, right now, we haven't reached that level in several areas. That day may come when different decisions have to be made. I think what we're trying to do now is do the things that we can do now to help that situation, maybe not get to that level if at all possible. But at the end of the day, you know, those will come and they'll be made through the community, and we'll all work together to get each other through that, because that would be very challenging. And we know that that kind of hit to the economy is very difficult. I mean, that jeopardizes people's ability to even live and to get food and to do the things that they need to do to survive in their own lives.
Well, I will tell you that that's already happened when the governor ordered no in-house dining at restaurants and bars.
That's putting a lot of
people have
that's
lost
hard.
their jobs.
They have.
So why do some people lose their jobs and some people get to keep their jobs? That's a question. So
There's no exacting answer. You know, we do what we can to try and stabilize our economy at all times. That's basically one of the primary functions of Tony's and my job. But there are certain things we can control and certain things that we cannot. And we do everything we can to encourage people to patronize our local businesses. You know, the folks that own these things put their blood, sweat, and tears into these, and oftentimes they're not necessarily living paycheck to paycheck, but something like this can put them out of business. They're getting very creative. I think there was a picture in the paper this morning about how Jerry O'Brien is handing out food at Nine Irish Brothers, which is pretty creative.
did that elicit a directive to the bars and restaurants today, that photograph?
I'm not sure if that photograph
Because
did.
there was a patron seen in that photograph having a beer.
Okay, I'm not aware of that photograph, but you know, at the health department, first, just to echo what the mayors have said, these decisions about closures and about modifying activities and organizations and postponing events are very difficult decisions to make. And as a health department, you know, when we make recommendations, we make them based on data and science, and we have to have compelling evidence before we would recommend a specific closure of an organization or any sort of modification to their activities. But what's important right now is for everyone to remember social distancing, which you heard from the first three guests who were out here. And for all of us, whatever environment we work in or exist in, we need to find ways to make that social distancing part of our environment as much as we can. It's not always possible given different types of jobs and contact with people, but making those changes to our environment, to our behavior, those are the things that are going to help mitigate this situation. We use the word mitigation strategy in public health. Those are efforts to reduce the spread of the virus and particularly to protect vulnerable individuals. So those are the elderly, people with other chronic medical conditions that may weaken their immune systems. Those are the people that are at risk for becoming severely ill from coronavirus, and we need to do things to protect those individuals.
Mayor Dennis, I cut you off. You were talking about, I guess, small business creativity and people finding ways to deal.
And they are, and basically that's what they're trying to do. They're trying to figure out ways to continue to have the traffic come in through their doorways, but do it in a safe way. The businesses are also encouraging people to be informed and be aware. And you know, we've had several different scares like this over the past 50 years. And some of them were real, and some of them had a significant impact on people's lives. Others were just people overreacting to a lack of information. And with the way we have technology now, things can get a broadcast of 50,000 people in a matter of minutes. It's imperative that people are intelligent about what they look at and what they read, and fact check. I mean, I know that we're printing as much information about this disease, this virus, as possible. And that's how we can keep people aware of what's going on. The other thing is that when we talk about our small businesses, our small business environment, going through the door isn't necessarily a bad thing. It's what happens once you're inside. Social distancing, being aware of your environment, being aware of what's going on is also viable. Now that we obviously have a challenge because of the closures, but I think at the end...
There is some work going on in that area with the
Yeah.
Greater Lafayette Commerce, City of Lafayette,
Yes.
West Lafayette, trying to, on our social media outlets let people know who is doing carry out and different things like that, and trying to push people to those
We are really encouraging people
businesses
to
and
go there and buy the
creating
carry-out.
lists to try to do that, because
We've got a link to that
Yeah.
list, by the way, on our
because it is a
website,
difficult
so-
situation,
we appreciate that.
and we certainly understand that. And there's not going to be a perfect answer. You know, the same thing could be said, why can some people work from home and some people can't? Well, some jobs just require that you're there, and it's not going to be equitable on every level of what we try to do, and that's like Dr. Adler said, that's why these are difficult situations. But our community is well positioned, I believe, because of the cooperation that we have and because of the kind and compassionate community that we are. You've seen some things today. The United Way is working with the Community Foundation to start some funds to help people that may be really hurting already, and there's a lot of donations and the things that we're working with food finders. The City of Lafayette closed some streets so they can do drive-through pantries. We have city workers that are actually out directing traffic at some of the locations for the schools. This is a giving, caring community that's going to pull together to find resources and to help us get through this medically, economically, and on a very human level. And I honestly believe that. I believe that's what this community is about. We're going to have to make tough decisions, but together we're going to get through this.
Okay, I'm going to go over time on this segment. So a real-world question for Dr. Adler from a viewer. Quickly, if you could. I want my kids to stay home and not go out with friends or have company at our house for the next 30 days. Do you think this is important to allow COVID-19 to die down, or am I being overprotective?
No, I think you're not being overprotective. That's exactly the right thing you want to do. It's important for all of us to really lay low and to avoid those social interactions, especially with larger groups of people, to the extent that is possible.
Okay,
and so
that came from a father named Todd. So Todd, you have permission to keep the kids in for at least a month. All right, thank you so much, gentlemen. I really appreciate you
Thank you
watching
for having us.
Coronavirus Conversation on News 18. When we come back, the Lafayette School Superintendent and an expert on consumer purchasing behavior. You won't want to miss that. Dr. Will Miller, coming up later in the program. Stay with us.
Do we get the tough questions?
Do you want tough questions?
No. There we are. And we're out.
We interrupt programming to bring you this News 18 special report. News from where you live.
And welcome back. We're having a coronavirus conversation. We're joined now by Lafayette School Superintendent Les Huddle. Mr. Huddle, thanks so much for coming in. I know that you and your compatriots at the Tippecanoe School Corporation and the West Lafayette Community School Corporation have been talking about this for quite some time. And I don't ask you to speak for them, but is your decision making taking place in that kind of structure?
Absolutely. We are communicating literally daily and have been for probably the last 3 weeks. We know we're a community that shares resources. We're also 3 school corporations that share students. Our Linwood School has students from all 3 school corporations, our new Career Academy. So when we make a decision, we certainly touch base and run ideas off each other, and that's where we're still continuing with today.
What was your biggest fear with cancel or extending spring break? That's where you are right now.
Correct, right. Yes, extending spring break, we're all 3 right now through Friday, April 3rd. We may hear some new information tomorrow. We'll wait and see.
Now, wait a minute. We may hear some.
Our governor is speaking tomorrow, and
yeah, he's going to be speaking at
yeah,
1.
and we're waiting to see if there's any new direction. We're kind of in this make a plan and wait and see what happens. To give you an example, a week ago, we had what we thought was a very good plan in place, all 3 of us. And at 1 o'clock, we started deploying the plan, and by 4:30, it was in the garbage because the governor had come out.
Try to put a newscast on.
I understand. Yeah.
Yeah, and that happened today, you know, with the announcement. Well, that leads me into a question that we got from a viewer. Why are schools still expecting to have students return in mid-April with local colleges already agreeing to continue classes online for the rest of the year? Shouldn't all of the local schools be doing the same thing?
Again, we're working on that decision right now. As we continue to get information, we do have some directions from our state. They've granted all the schools 20 waiver days, they're calling. We have to, by code, have 180 days of student attendance. The governor's given us those 20 days, so in theory, we can have 160 days. There's some talk this morning from our Department of Education of those waivers may increase in the future, but if we don't meet those days that are currently still on the books, we don't want to get in that situation. So we're hoping for some more concrete direction from our Department of Education and the governor.
Is there discussion taking place today that the current difficulties will impact the fall semester?
Absolutely. We know that there's a high probability that our 3 weeks that we're looking at right now may be extended another week, 2 weeks. The rest of the semester is still an option. We are all working on plans of what happens if we can come back and what happens if we can't. So we're trying to get all those things organized and planned out.
You never expected to run into this kind of difficulty when you were studying education administration, did you?
No, we didn't. But as you're in the business, there are certain times where you have these situations. The difference of this one seems to be the length that it's going to go on, and then also the uncertainty. We're having to make plans without a lot of answers. An example, what happens if we do go out the rest of the school year with graduates and kids getting credits, our career and tech courses that have to have so many hours out in the field. We are hearing our Department of Education in Indianapolis is aware of all these concerns. They just don't have answers yet.
Do you have concerns that a child's education will suffer if this goes on long enough?
Right now, that's not our main concern. Our main concern is the health of our students and our families.
And you've got a lot of kids, and we've talked a lot about it, and national media has as well, too. A lot of kids really depend on the school system to eat.
Correct.
Or to receive healthy, nutritious food. What have you done to make sure that nobody's fallen through the cracks?
Well, A lot of people don't understand that our lunch program is a federal program, not a state of Indiana one. So we have to follow the federal guidelines. And when you have a situation like this, some of the guidelines have been that we had to follow were you have to feed the kids and the food cannot leave the schools. So that kind of threw a curve at trying to feed the kids. But again, from the federal now to the state, now to locals, those rules have been relaxed. So we are starting, the Lafayette School Corporation will be starting to offer food service this Friday and go through April 3rd. If we need to extend that, we're ready to do that. We'll be at Glen Acres Elementary and we'll be at Miller Elementary. The United Way has organized some community other organizations and donations, and they will be at Sunnyside and Tecumseh starting tomorrow.
Okay, and that begins at 11 a.m. at
I believe
Sunnyside
so,
and
yes.
Tecumseh. Okay, thank you very much, Mr. Huddle. All right, along with school cancellations, teenagers now have one less place to potentially contract or transmit the virus. As we mentioned during the last segment, Simon Properties shut down all of their malls, including the Tippecanoe Mall, just within the last hour. Now, that decision will also have a further economic impact, along with restaurant closures and grocery store panic buying. We're joined now by, to talk about all of this, is Tim Moore, a consumer purchasing specialist from Purdue University. Dr. Moore, thank you so much for coming in. I wanted to ask you what you have made of consumer behavior over the past 10 days.
Well, it's been mixed. Locally, people seem like they've been fairly calm and fairly understanding.
Really? There was no toilet paper when I went to the grocery store.
And then most recently, there's been goods running out, particularly toilet paper. It seems.
What's going through people's minds?
Well, people are concerned. We've heard that there's a lot of uncertainty, and people want to stock up. They want to make sure they've got plenty of things at their house. But what I would say is there's been no evidence, and there's a lot of uncertainty, but we should be fairly confident that supplies will be available. And so here and then in other countries such as China and Italy, where they've had a lot of problems, supermarkets have been able to be supplied all the way through. People have had access to food. So the only problem is going to be if people get scared, people hoard, then supermarkets and other stores run into problems.
Well, would you say that we have hit the threshold for hoarding at this point, if there's no toilet paper or cleaning supplies in the stores?
Yeah, it's obviously an issue, and some stores have tried to deal with that by placing limits. There's discussion around restricting certain hours, maybe giving preference to seniors and so on. All of those aren't great solutions in terms of managing it. It adds more pressure to store employees. It adds some stress in policing these. I mean, my hope is that there's been some hoarding. People have gone out and bought a lot of stuff, but then there's only so much toilet paper, so much pasta, other goods that you can have in your house, and then as supermarkets continue to restock, that we end up in a more normal situation.
I intended to ask this question of others of our guests, but do you think that consumer behavior will permanently change as a result of this situation?
I mean, some things may change. Some people might try online shopping for certain things and find that there's convenience associated with that. I think for many people, they're just trying to make it through things in the short term, a time of great uncertainty. And so I think most things will return to normal, but there may be some, through trying different things, people may sort of change some of their behaviors in the longer term.
Pick up new habits.
Yeah.
So briefly, give me a description of what your specialty is at Purdue.
So I actually do work on health economics and public economics. And so some work around social insurance, which is going to be a big issue in the coming weeks as people are laid off, people haven't got access to income. I also do some work around public health, around the opioid crisis and those sort of things.
From a 30,000-foot view, this gives you kind of a petri dish to study, I guess, right? I mean,
Yeah,
behaviors of people.
Yeah, absolutely. In the longer term, there's some interesting. I mean, there'll be lots of things to study, lots of things to learn. There are sort of recent experiences. So when it comes to things like stimulus payments, we've done those in recent years. The federal government did it in 2008. They did it in 2001. And so some of these conversations, there's things that are different here, and arguably the responses need to be quicker and larger. But there is experience that can be drawn on both at the federal level and at the local level in terms of dealing with some of the economic responses, as we heard from the mayors.
Okay, very good. Thank you, gentlemen, for joining us. We'll be back with a look at the psychological impact of a major event like this with Dr. Will Miller right after this.
We interrupt programming to bring you this News 18 special report. News from where you live.
Welcome back. We're closing out our coronavirus conversation with a discussion with Dr. Will Miller, who counts among his titles minister, therapist, educator, and psychologist. Dr. Will, thank you so much for coming in. I think I left one off. You consider yourself a comedian too, don't you?
Yeah, yes, I did 17 years of comedy, which could make the ratings tank here, but...
So which one of those descriptors would you like to take on tonight?
I think really therapist. I've been a therapist for 30 years, and I still do a lot of counseling. And my area now, I'm very active as a counselor with first responders on trauma and post-traumatic stress disorder. So I know my way around and have a heart for. 40 million Americans have an anxiety disorder. That's before any of this.
Oh yeah, it's higher now.
15 million depressed. And so this is the perfect storm to either exacerbate your anxiety or to trigger anxiety in people who otherwise are resilient.
So I wanted to close this with you because I thought you could help talk people off the cliff, right? There is an understanding that this is an anxious, stressful time.
It is. It's just off the chart.
It can be managed.
Absolutely. I mean, you're really talking about resilience, and resilience is a term that is in the face of or in the aftermath of some crisis or something that has put you down. How do you get up and go forward? And resilience is really about doing things that help calm you. I'm a big advocate of meditation and other things that help calm you when you feel like you're getting too rattled. But also, you know, Jeff, I've been talking for a long time with my colleague Glenn Sparks at Purdue about social isolation, the fact that we move away and we don't have nearly the people we have. It's a crisis in the culture before this. So now, what's ironic is a lot of the problems of social isolation were laid at the feet of, say, social media, for example, that isolates us. Well, guess what? The irony is that can be a tool for us to kind of find our way to calm down.
Can I disagree with you on that?
Sure, of course you can.
I saw your Facebook post regarding that, and I was going to comment on that thing. My advice would be to stay away from it.
Well, here's the thing. But in other words,
You're the expert, though.
Well,
so
no,
I'll
but
you...
think about the situation for all of those who are isolated right now, who have to be doubled down in their home and they're disconnected and they don't have their normal relationships. It's not using social media the same way you have, but this is a good time to say stay connected to family members or others or friends who you know are supportive of your circumstance. Being resilient means you have a plan and you feel like you have competence to step forward. Well, what can you do? You can't control any of this, and that's part of the anxiety here. You know, I think about how many people just in our own community have all of a sudden, with a brood of kids, become homeschooled teachers. It's like, who thought that would happen? And that's a challenge, but like, what are you going to do? You can either become passive and, you know, just feel like overwhelmed by this, or you can step up. What helps you step up? Well, not everyone has the wherewithal temperamentally to find a way to step forward, but you know people who do, you have friends who do. I mean, I think, for example, faith communities and churches are doing a really good job of creating a lifeline for people. So, you know, phone calls and, again, social media or whatever, when you can't visit in person, for people to give you encouragement. And also, if you are going to be a news person, try and limit, you know, to stuff that's uplifting and positive shows, etc. Follow the news for the information so you're alert. But remember, everyone is at risk for anxiety. And what we're trying to do is ameliorate those symptoms from getting out of hand, to not panic. And that's a hard thing to do.
Now, we are here at News 18 ending every 6 and 11 o'clock newscast with a message of hope.
Great.
From a faith leader. And we're going to branch it out to just chronically happy people. And so you're going to record one of those.
Good, good. You know, some people just, in other words, for those who have a temperamental inclination toward anxiety and depression, there are others who just have a cheery mood. Get with those people. Just get with those people. Get with those people however you can. There's a lot of stuff in the online world, whether it's films or whether it's YouTube.
Dr. Wilth, they're cutting us off. Can you save it for your message of hope?
Sure, absolutely.
All right, I'm sorry.
No, it's okay.
We've got to get out on time to pay the bills.
That's
been
okay.
a Corona